The Asian American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with Apina of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Marife Aczon-Armstrong.
Aloha! Good evening. Magandang gabi po sa inyong lahat. Naimbaga Sardam, maayong gabi sa inyong tanan. Here we are again. I'm yours truly, Dr. Marife Aczon-Armstrong, founding president and immediate past president of the Asian American Pacific Islander Nurse Association of Nevada and professor in nursing at Roseman University of Health Sciences College of Nursing. So Healthy Monday here again on a Monday. And this is the last Monday of February. And we feel that it's very fitting that we celebrate Black History Awareness Month. And I have my very good friend and colleague who presented with me in the American Nurse Association regarding a boosting confidence in the COVID-19 vaccination among the ethnic minority population. And during that presentation, Dr. Tanya Sorrell spoke of a African-American hero that often a lot of people don't know about. And she also has another African-American nurse hero that she's going to share with us tonight. So welcome, Dr. Tanya Sorrell, to Healthy Mondays. You're not new to Healthy Mondays, right?
No, but I'm always thankful and happy to be able to participate in your show. So thank you for welcoming me at this such an opportune time, not only in Black History Month, but also recognizing the challenges of our day and how recognizing history helps us to recognize all of our places in the world at this time.
Yes, thank you for agreeing to be our guest tonight again, but please share with our listeners a little background about yourself.
Well, my name's Tanya Sorrell. I'm a psychiatric nurse practitioner by clinical training, and I'm the associate professor of psychiatry and behavioral sciences at Rush University Medical Center. As part of that work, I serve as the assistant director for the Great Lakes Clinical Trials Network, which helps to increase the opportunities for diverse clinical research for those living in the areas of Illinois and Wisconsin, as we always need additional diversity in our clinical research pool. So that's an additional area that we've been working on as part of NIDA and the National Institutes of Drug Abuse and National Institutes of Health. I'm also the director of the Rush Substance Use Disorder Leadership Center, which partners academically with community partners who are working boots on the ground to look at decreasing the impacts of the opioid crisis and our overdose crisis now, to really be able to reach out and provide harm reduction, brief screening and referral for treatment, and to develop a plan for long-term recovery for those persons who are using drugs.
Wow, Tanya, such very important community outreach there. And what a great project for those who are underserved and those who really need our help. And for our listeners out there, Tanya and I are co-alumni for the Substance Abuse and Mental Health Service Administration's Minority Fellowship Program. So we go a long way with helping our community out there, especially our underserved population, especially the ethnic minority population. But tonight we're going to share with you, actually Tanya will share with you the history about how we're able to manufacture vaccinations or vaccines and how it came about. And it's truly an amazing story. So I'm gonna give Tanya the platform to start the story about this amazing African-American woman.
Well, thank you, Dr. Aczon-Armstrong, because it really helps to set the stage and to know when we know all of our history, we realize that we all have a part in history. Henrietta Lacks was a typical African-American woman married with children, but who at the young age of 31 developed uterine cancer. At that time, one of the few hospitals in Maryland to actually even to see African-American and treat African-Americans was Johns Hopkins. And so she went there for treatment. and was told, unfortunately, that her cancer was terminal. During the time that they attempted treatment for her, they actually took a biopsy of those cancer cells, as research was ongoing at that time in the early 50s to understand cancer better and to find some types of ways to be able to treat cancer that people were suffering at the time. Prior to that, when a cell was taken out of your body, though, and attempted to grow on a petri dish, there wasn't a way that those cells would continue to live. So there was no way to study those cells long term. Unfortunately, Henrietta Lacks passed on October the 4th, 1951. But during those last months that she was in the hospital, a great discovery occurred. Henrietta Lacks cells lived, grew, and multiplied in those petri dishes and lived for many hours so that researchers could study them, could understand the development and growth of cancer, and then had what we call a cell line of actual live human cells for the upcoming medical developments that will occur because of that. The first one was the other issue that was happening in extremely infectious ways at that time, which was polio. Every summer, kids would be afraid to go outside or to get near water because many kids would become sick. Some kids would become paralyzed. Some kids would lose the functioning of their lungs and end up in an iron lung, and some kids would die due to polio. As the polio vaccine was being developed, one of the first things that was done was to actually test the polio vaccine on those cells that Henrietta Lacks' cells that were continuing to grow outside of her body and in petri dishes, to see that once the cell was vaccinated, that you weren't able to get polio from it. Interestingly, the Tuskegee Institute medical providers also worked with Jonas Salk on the development of those polio vaccines with Henrietta Lacks cells. Other accomplishments were the discovery of DNA and understanding of the cells and the makeup of DNA. Numerous other types of cancer and chemotherapy treatments, numerous types of other medical treatments, new medicines were discovered and tested using Henrietta Lacks cells. Henrietta cells called HeLa for her name, Henrietta Lack. Those cells have gone up to the moon to see how human cells respond in zero gravity environment. Those cells have gone all around the world to help numerous people with different medical problems, different medical diseases, and to heal many people across the world. And those same cells that continue to live even to this day were part of the initial testing on the current COVID-19 vaccine. Now, sadly, at that time, no one ever told Henrietta or her family that her cells continued to live even after she was gone. And many companies outside of Johns Hopkins made billions of dollars from the development of the medications, treatments, vaccines, and other therapies that were brought about from her cells. So it wasn't actually until about 2010 that a book called The Immortal Cells of Henrietta Lacks not only showed the world, but also illuminated to her family that Henrietta in many ways was alive and a savior of most of us all on the planet, even though she had passed way back in 1951. Today, Johns Hopkins works with the descendants of Henrietta Lacks to have a better understanding and discussion, not only of how research is done on cells and cells that may come from your body from biopsy, but also so that Henrietta's cells are put to the best purpose for medical discoveries to this day.
Wow, imagine that from one person, all of this scientific development, especially in healthcare, right? So, wow, there's a lot more information that you shared during our webinar. And I think it's very fitting because right now we're still in the middle of the pandemic, although slowly we are now taking away all of the restrictions. And just think about it that we are now getting to know the coronavirus. And so before, we are just like scared about it. We don't know how it's going to react. We don't know the kind of treatments that we're going to get. But now we're starting to understand how it behaves and how we can protect ourselves. And thank you for that amazing story that you shared about Henrietta Lacks, and how the development of vaccines, starting with the polio and her DNA. So her DNA is still growing right now. Where is it kept?
That's actually a good question. There are cells from Henrietta Lacks in most academic medical institutions all around the world. You can actually order her cells, and it's called the HeLa cell line, from a number of different scientific companies. But as we said, now Johns Hopkins works with Henrietta's family so that the activities, the research behind those. And so if you're looking at requesting those HeLa cells, that it's the research that can help mankind, it's research that won't potentially have a negative slant or some of the stereotypical issues that may have affected African Americans and their concern about participation in research in the past, and that everyone will have access to them. One of the areas that we work on and focus on now is that the world should have access to the COVID-19 vaccine. And part of that discussion and determination was from the initial lack of disclosure regarding Henrietta Lacks' HeLa cells, and now the scientific community's attempt to really make amends and reparations for the lasting damage that may have done by the lack of communication and transparency to not only the medical community in general, but to African Americans in particular, who unfortunately have frequently been on the negative end of medical encounters in the past. And unfortunately, these types of issues, when they do come up, such as the Tuskegee syphilis study, or the denying of certain treatments to African Americans and not being able to participate in medical care at any hospital, those issues continue, unfortunately, to negatively impact minorities when they look at seeking care, because the lack of trust, the lack of transparency, and concerns about honesty in this discussion. And we know that that has had an impact as well with COVID-19.
Yes, I think that's, you hit the nail in the head about transparency. I think that's very important. It is really, we are being forced to disclose a lot of information because of technology. A lot of people have a smartphone now. They can record things. I don't know if you heard about, it was my son who told me this morning about what's happening in Ukraine. You know, I think that we still need to, even though our topic tonight is about the Black History Awareness Month, but we still are not, we still need to be aware of what's happening right now in the present. And I think that I'm talking about the advanced technology, that they actually have video and live stream some information that's happening there.
Yes, that's very important, not only to have the ongoing information of what's happening now, but to also recognize, just as you said, with what's happening in Ukraine, that there may be others working against your having the knowledge and the truth. So unfortunately, there's a great deal of disinformation that's equally available and sometimes easier to find on the internet than the truth or real information. And so it really takes discernment and really a good understanding to be able to know what actually is true and what's happening in real time and what's happening accurately versus what someone else might be trying to use to manipulate, to disinform, or to lead you to making a poor decision. We sadly saw that with COVID-19, such that information about true decisions, about true FDA emergency use authorizations, about the studies, about the vaccine, unfortunately was hard to find when there was lots of disinformation about the 5G technology or a chip inside the vaccine, or that the vaccine might make you sterile, which was disinformation that was being put out there by sources that didn't want people to have access to the COVID-19 vaccine. So it's important, as you say, to be, harmless as sheep, but wise, to be able to make those decisions and discernments, to be able to recognize what's true and to be able to leave behind what's not true. And that's unfortunately happening right now in the Ukraine as well.
Yes, I think it's you have mentioned a lot of issues here, the transparency, the information, all the different information that's coming left and right, and that our community out there needs to learn how to discern which one is the truth and which one is fake news.
Exactly.
I think it's a time where we need to be wise about the information and also investigate before you take it as it is at face value. Always investigate what's the truth, and always look for the source that are that you can trust, that that the information that they're giving you is based on facts. And I think that trust is a big thing. The trust is there's the reason why people are not what is that word, are resistant to good information that you want to give them. But with the celebration for Black History Awareness Month, I know that you wanted to share another African American what was overlooked even during the time of Florence Nightingale. And I saw it in the media, social media, and I think I also saw it on in linked, and somebody was celebrating her. So I guess maybe you can introduce another African American woman who was overlooked during Florence Nightingale's time.
Exactly. And unfortunately, and this actually is in that same part of the world as Ukraine, because we recall that Florence Nightingale actually gained her knowledge, practice, awareness of the vocation of nursing during the Crimean War, which is part of Ukraine. What isn't generally told, unfortunately, is in that same time, in the late 1800s, a British Jamaican nurse, Mary Seacold, was also in Crimea working with the soldiers of the Crimean War, and actually even providing treatments from the indigenous practices that she had learned as a Jamaican nurse, such that many times she was closer to the war front than even Florence Nightingale was, and unfortunately suffered from the same discrimination and racialization that was apparent at the time. So that Florence negated much of her work, and when Florence returned to England, rather than upholding and supporting a fellow nurse's work, such as Mary Seacold's, it was discounted until only recently we became more fully aware not only of the role of Mary Seacold during the Crimean War, but that actually she wasn't just also a nurse there, but she actually was considered the first nurse practitioner, as many of the treatments, therapies that she used from her knowledge of indigenous Jamaican practices actually were served as types of medicines for those soldiers that were receiving treatment during that time. And we recognize,
So she was part of the healthcare team that was taking care of the soldiers who were wounded during the war.
Exactly. And unfortunately, being a Black nurse at that time, in the 1800s, Blacks still had that second class or less in the way of citizenship. She didn't receive the accolades that Florence Nightingale did. And sadly, Florence Nightingale, being a person of her time, also discounted the work of Mary Seacold, and unfortunately had very negative attitudes towards those of African heritage, American or from other countries. And so unfortunately, it was only in the last 50 years that Britain has actually vouched for the work that Mary Seacold did, has named statues and hospitals for her, and now truly recognizes her as the medical pioneer that she was, right alongside Florence Nightingale.
I must say that it's good that this is happening, even though it's it's kind of late already to acknowledge her, but still it is this hope that we have that diversity is emerging, that our desire to be equal, our desire to treat everyone equally is emerging. And even though it's a long time ago, then people are just really doing a self-reflection and saying, what happened in the past, and how can we make it right? And I think a lot of people are making the effort to make things right. As you said, with the African American nurse practitioner, and who was not acknowledged during that time, but now being acknowledged. And I think it's really good. We need to celebrate these changes that's happening in the world now. I think if we continue to fight for diversity, equality, and inclusion, that we're going to encourage people, especially the system, the decision makers of our system, because I know that we talk about discrimination, we talk about equality, we can talk about it all day long and many years, but if we're not changing anything in the system, then it's not going to happen. But I really, I think it's we have hope that that is happening. So
and it's always an important reason when we recognize, just as you said, there is a move to try to bring to the forefront, in a way, a bit of, as you said, a truth and a reconciliation of our neglect of the role of non-whites in our medical societies, in our history in general, and to recognize that they have a place as well. And remembering alongside of that, anytime there's a move to bring that to the forefront, there's also going to be a move from supremacist groups to suppress it. And we see in a number of schools and a number of methods that people are trying to say, no, we don't want to make white people feel bad. But talking about Mary Seacole doesn't negate the role of Florence Nightingale. It shouldn't make people feel bad to recognize that there were two nurses there as pioneers. And we also recognize that when we don't discuss history from a truthful manner, that we end up causing negative outcomes for those currently. When we discuss vaccination, for example, having known by the general population that Onesimus, an enslaved person, was one of the first people in the United States to help his masters learn how to inoculate themselves from smallpox and prevent smallpox in the 1700s. And then if we had known Henrietta Lacks and the Tuskegee physicians' research in the vaccine for polio, if we were aware of the history of Dr. Kizzy Corbett at NIH, who helped with the development of the COVID-19 vaccine, if we had known those threads of history and medical research from Blacks as well as whites in vaccine studies all throughout the US history, there may have been less hesitance and reluctance regarding the COVID-19 vaccine for minorities when the COVID-19 vaccine came out. So denying history impacts health negatively. And it doesn't negate either side, but it brings everyone up to the glory that we should work towards in working together for the diversity. And as we said, the beloved community of all of us working together for good.
Exactly. And I think we owe it to the future generation so that we don't hide information from our history, because they need it. They need to learn from our mistakes. And if we don't share and be transparent in what's happening, then the same mistake is going to happen.
Exactly.
And I think as that song says, the children are our future. And if we don't share with them all this information in the past, the history, then I think that then they will end up having to start all over again, because then they realize that, oh, okay, that happened before and it didn't work out, or that happened before and a lot of people died from it or suffered from it. So I think that it's good that we're having this conversation here on Healthy Mondays, and to allow our future generation to understand where the vaccination are coming from and how it is developed and how a lot of people have been saved from the polio disease, and now here we are in COVID-19 global pandemic, and realizing that without that foundation, we won't be able to find any treatments for this and understand the behavior of this virus that we're still facing right now. It's not over yet. I always tell people, because this Sunday today, when I went to church, there was a man sitting by me, like, of course there's a seat, and he was coughing, and I'm like, I don't have my mask. Anyway, we're digressing into what's happening right now, but it's very important, to celebrate each other. February is the month of it's a Black History Awareness Month. And that's why I have Dr. Tanya Sorrell with us tonight to share with us about, she talked about Henrietta Lacks, and I forgot about the name of the
Marife Cole. Mm-hmm.
Marife Cole, yes. I know that I saw it on the social media. I go, wow, I didn't even know this. So it's good for our nursing students to know about this, that there's also another, nurse who made an impact during the war, right? During
the Crimean War, exactly. And to know that even today, for example, the current clinical trials network here at the Great Lakes Clinical Trials Node for NIH, we actually go to the community and talk with them about what are the issues and concerns for the community. Then from those research questions, we develop our research studies. And so the community is aware every step of the way of how research is developed, how subjects are recruited to participate in research, what types of research is done, and then most importantly, to give back the feedback and results of that research so that the community that is participating in that research is aware of the activities all the way through. That increases trust, knowledge, and acceptance of the results of the study, the work that we do, and helps to make sure that the research that we're studying will benefit and make a difference for the communities that we serve.
I'm glad you mentioned that about community engagement, community outreach, and then going there and explaining to them. And again, building that trust and also being transparent of what are we going to do. Because it's the same thing when we go out in the foreign countries doing mission. They usually say, oh, are you just going to be here now? And then after you finish, then you leave and that's it. So it's the same thing that's happening in Hawaii. Native Hawaiians are very reluctant in participating with research because they don't know what's happening, and they have been burned before, where researchers go in and then they do what they need to do and then they leave, and there's no follow-up. And I think that's very important. The increasing awareness of what you're doing, giving them education of what you're doing, and then also the evaluation and sharing with them the results, right? So I think that's really a true informed consent, and also allowing your participants to really be participants, right?
Exactly.
That's what we call participants.
And to participate on an equal footing in the discussion, the research process, and what we call the dissemination or the communication about those results back to the public from where the research started.
Wow, it's always a pleasure having a dialogue with you, Tanya. Time flies when we're having fun. That's my cue.
Exactly.
I wanted to ask you to share with our listeners out there words of wisdom before we say goodbye to them. Words of wisdom in relation to the Black History Awareness Month.
Black History Month developed because of those same issues that we talked about earlier, where Black history was not reported, was in fact denied. Are the work of Black leaders like Marife Cole or Henrietta Lacks leaving a legacy to us that went unnoticed. But when all history is taught evenly and with diversity, then all history will be a part of all of our work. And the goal will be to have the level of importance, the level of knowledge, and the level of thanks for having the full picture of history, whether good or bad. It all informs us for what we do next so that we continue to work towards that better union, the more perfect union that we have for the United States, and the love and humanity that we should care for each other as well.
Wow, that's a lot to digest and to reflect on, Tanya. And I guess the bottom line is in the lesson that to be learned here is that we need to celebrate each other. Mm-hmm. We need to celebrate triumphs, and we need to celebrate victory. We need to celebrate accomplishments regardless of color, regardless of race. And when we celebrate each other, then we see a common goal. We all have a common goal, to make things better for everyone. And I know I'm going to share my faith, all things are created for good, for the good of everyone. So there's so many things that we wanted to share with you. Tanya and I, we have gone a long way. As I mentioned, we're co-alumni with SAMHSA Minority Fellowship Program. I do miss our sisters and brothers from that Ohana.
Oh,
but,
yeah.
So thank you for the wealth of information that you shared with us tonight. And I hope that this is a great last Monday of February to share with you the Black History Awareness Month. So Tanya, I'm going to tap into you again with other topic that I'll think about. So congratulations to your position right now. And you always do good work. Always, you always have a golden heart. And so our listeners out there, thank you for joining us tonight. And I hope you learned a lot of information about celebrating the Black History Awareness Month and the people behind that we need to celebrate. Again, I wanted to thank you again, Tanya. I wanted to thank.
Always happy to be with you and your audience, and look forward to our talks again soon.
Thank you.
Take care and God bless.
Yes, and PHW Radio, Flora and Johan Stason, thank you so much on behalf of the APINA founding members. So remember, our listeners out there, every Monday is a healthy Monday. Aloha.
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with APINA of Nevada.